Dear friends, this is Dr. Ibrahim. I've been working in USA in one of the health department in Texas for the last 20 years as a chief epidemiologist and dealing with a lot of the infectious diseases. And I had also worked in Pakistan and Iran and practice as a physician, family practitioner, and work on infectious diseases in Pakistan, different health projects, and then Iran as an epidemiologist and dealing the diseases more prevalent in Iran, and then for the last 20 years I've been in USA. So I'm going to talk about a very emerging disease that is the coronavirus, and I will try to make it very simple so everybody can understand without going in many medical terminologies and detail. So what I'm going to talk like about coronavirus, as we all know that this coronavirus has been like in our environment almost is going to be in March a year. We were thinking that this disease is going to go down in like 5 6 months. In summer times there were different speculations, but it did not come true. And we are still having like a lot of cases throughout USA and in Pakistan and throughout in every part of the world. Let's talk about coronavirus variants. There are three variants that are found so far and recently. One variant is UK variant, and the second variant is a Brazilian variant, and the third variant is South African variant. So these three variants, according to CDC and according to all the research we have so far, these variants, what is variant? This is a different form of the same virus. Like for instance, there was a form of the virus like that. The basic form of the virus was like that, and when it changes the shape or mutate, like it is in different forms, that is called different variety or different variants of the same virus. So it different variants as of now, they can spread very easily from person to person as compared to the coronavirus variant that was in the environment before. But so far we have not heard many severe illness or deaths in the people who have come across these variants. So it is a good news that it is not making more deaths or illness severe enough and killing the people. So let's talk about the vaccine. In USA, there are different. There are two types of vaccine. One is Pfizer vaccine, and one is Moderna vaccine. Pfizer vaccine, both the vaccines are given in the muscles here, and in Pfizer vaccine, there's after first dose, the second dose is given in 3 weeks period. Whereas in Moderna vaccine, after first dose, the second dose is given in 28 days or almost a month. Both the vaccine, there's a little bit allergic reaction. After first dose, there might be a soreness, there's a pain at the site or feverish condition for a day or two, not more than that. But the people who have received the second dose, they have said that after the second dose, the reaction is more severe as compared to the first dose. What are those reactions? Like it may be a fever of 100 degree for a day or two. They feel more tired. They feel that they don't have any energy. So this all reaction goes for a couple of days and that comes to an end. So in fact, we have not heard much side effects of the vaccine. So the benefits of the vaccine are more. So when the vaccine is made available, please get the vaccine. There are a couple of questions people have been asking, and this is more concerning. The first question they ask is that how long this vaccine is going to be effective. We don't have data to say that this vaccine is going to be effective for 1 year, 2 year, or 3 years. So we don't know that. So a lot of work to be done to answer this question. The second question is that if I had COVID-19 disease, should I receive the vaccine? The answer is yes. You should receive the vaccine. But the vaccine cannot be given in 3 month period if you had the disease. Meaning you can get the vaccine after having the COVID disease 3 months after the disease. right? Now the vaccines available to the priority group. And what is priority group? The first responders, health professionals, and those people living in the nursing homes, because they have in the advanced age, and they have more medical conditions, so they are more at risk. But the vaccine is not made available to the general community, general public, and I think it will take a month or so when the vaccine will be made available. So when the vaccine is made available, please don't hesitate to get the vaccine. Get the vaccine, since I said the benefits of the vaccine are more than what you think is the little small side effects. So I hope you like this video. If you like this video, you can make the comments in the comment section. You can let me know in like what questions do you have in your mind related to the COVID-19 disease and vaccine, and any question related to that, and I would like to answer the question, upload the video as soon as I have time. Other than the COVID-19, if you think you are interested in other diseases, please feel free and don't hesitate to put in the comment which disease you want to know more in detail, and I would like to make the video and upload that video with all the information and that you think you need to know about that. So I would like to go now and say goodbye to you. Please don't forget to subscribe my channel, and if you like this channel, please click on the like button as well and leave your comment. I'll be waiting for your comment as well. So I'll be coming again with the new video, with the new information, and we'll keep you all posted about the COVID-19 disease, vaccination, and a lot of factors related to this disease. Now I say goodbye to you all. Thank you very much for listening to my video. Thanks. Bye-bye.